Hi, how are you today?
Hi.
My name is Marika. I'm going to be your student nurse.
Okay.
So today we're going to do a head-to-toe physical assessment. This shouldn't cause you any pain, but if you do feel any pain or if you feel tired at any point, just let me know and we can take a break, okay? So the first thing I'm going to start with is going to ask you a few questions.
Okay.
And can I get your name?
Lynette.
And do you know what the date is?
I believe it's April 19th, 2015.
Okay, and do you know where you are?
And an examiner
And why you're here?
for a physical.
Okay, so patient is alert and oriented times 3. And so today, for the physical, we have all our things set up. So this is going to be my stethoscope. We have some gloves, pen light. We also have a pen and a cotton swab. So, later on in the assessment, I'm going to ask you to recall these 3 words.
Okay.
It's going to be apple, cat, and house.
Okay.
Can you repeat them back to me?
Apple, cat, house.
Okay, so patient's speech is clear, patient able to speak with ease and fluency. And now I'm just going to start my assessment. So in general, patient's skin is pink, patient does not appear flush, patient's skin complexion is evenly distributed throughout the body. And then I'm going to look at your hair. So the patient's head is round, patient's head is symmetrical, it's erect on top of the body, patient's posture is also erect. I'm going to take out my gloves and inspect your hair. Okay. So upon inspection, there was no palpable masses, deformities, or depressions upon the patient's head. Patient's hair is shiny, it's brown in color, it's also evenly distributed throughout the head, and it is light and fluffy, no coarseness to the hair, and no infestations noted in the hair as well. Scalp appears healthy. And now we're just going to move down to the face. So facial features are symmetrical. Patient's facial features are also proportional to the body. The patient's eyebrows are evenly distributed as well as the eyelashes. They are both brown in color and symmetrical on the face. They are proportionate to the eyes. And can I just have you lift your eyebrows? So patient's eyebrows move bilaterally in congruence with each other. And then I'm just going to look at your eyes. So patient's sclera is white. Patient's corneas appear shiny and transparent with no visible marks or lesions on them. I'm going to take out a new pair of gloves and just look at your conjunctiva. Alright, this one down. Okay, same thing with this one. So patient's conjunctiva is pink, a healthy pink color, no visible exudae or lesions, no rashes or itching appear to be coming from the eyes. Patient's pupils are black, the irises are hazel colored and evenly distributed bilaterally. No deformities upon the iris color. And next I'm going to take out my pen light. And if you could just stare at this picture frame behind me, and I'm going to shine a light into your eye. Okay, and then if you could just look at the end of this, follow it in. Okay, so Perla, patient's eyes are equally round and reactive to light and accommodation. Patient's pupils are round and symmetrical. They both dilate to 2 millimeters evenly, congruently on each side. And then we're going to do the 6 cardinal fields of gaze. So if you want to just stare at the end of this and without moving your head, just follow the light. Okay, perfect. So patient able to follow the pen light. 6 cardinal fields of gaze are normal, so patient's eye movements are within normal limits. No nystagmus noted, and eyes move congruently. Then we're going to check your peripheral vision. So I'm going to stand behind you and just tell me when you see my fingers.
Okay.
Can you see them?
Yeah.
Okay. You ready? One more time.
See them?
Okay. So patient's peripheral vision is within normal limits. Patient able to see my fingers within a normal spectrum of peripheral vision as well. So do you typically use any assistive devices?
No.
Okay. So patient reports no assistive devices and no trouble reading. Patient will not be using any assistive devices during this exam either. So now I'm just going to inspect your ears. I'm just going to look inside. Okay. Alright. Just feel. Okay. So patient's ears are symmetrical on the face. They are both bilaterally even in size. They have no visible exudate or discharge, no excessive wax or hair noted on the inside. Auricles are even with the corner of the eyelid. Ears are flexible without pain and no excessive stiffness or excessive bending in the ears as well. So if you could just cover your right ear, and I'm going to whisper something into your left, and if you could repeat it.
Cat.
And same thing over here.
Dog.
Okay, so patient passes the whisper test, able to hear out of both ears evenly and with ease. So now I'm going to inspect your nose. Patient's nose is symmetrical in the face. Patient's nose is straight with no visible bumps, no visible deformities, no discharge coming from the nose. Color of the nose and ears are similar to that of the face, in that warm pink color. And if I could just have you close one there and breathe in. And same thing on the other side. So patient's nares are open and equal bilaterally. No excessive deviation to one side. Patient able to breathe through each nair with ease, and no audible sounds of breathing. So now I'm going to inspect your mouth. So patient's mouth appears dry, no visible lesions, no discharge coming from the mouth, no caries or anything visible from the outside. And if I could just have you open up and say ah.
Ah.
Patient's uvula rises midline. Patient's tonsils are present. They do not have any signs of infection. The tonsils are not red or appear to be itchy or swollen. Patient's teeth appear healthy. There are no visible caries. Enamel appears healthy as well. The gums did not appear to be retracting or receding. And also the tongue was a healthy, moist pink color, and it appeared slightly rough as well. And so next I'm just going to look at your neck. So patient's neck muscles are even bilaterally. No accessory neck muscles appear to be used when breathing. Patient's head is erect on the spine. Patient's neck appears symmetrical and proportionate to the body. Next thing I'm going to do is palpate, and if I could just have you swallow. So thyroid is non-palpable. Patient swallows with ease as well. It does not appear to have that the patient has difficulty or any aspiration when swallowing. And then I'm also going to palpate your lymph nodes. Tell me if you have any pain with these.
Nope.
Okay, so patient's lymph nodes are non-palpable. Patient states that she has no pain upon palpation of the lymph nodes as well. And we're going to do the sinuses. Any pain with that?
No.
Okay. So patient reports no pain upon palpation of sinuses as well. No deformities were palpated. Patient also, skin was warm to the touch with a cool hand, and does not appear excessively moist or hot. And then I'm going to palpate for your carotid pulse. Okay. So no palpable thrills noted with the carotid pulse. Pulse is strong at a 2+. I'm just going to listen and see if I can hear anything. Okay, so no audible bruits upon auscultation of the carotid pulse. So now I'm going to inspect your breathing in your chest. So patient's chest rises bilaterally. Patient able to breathe rhythmically and without any effort, excessive effort. Patient's shoulders rise bilaterally upon breathing as well. I'm just going to have you take a deep breath. Okay, so chest excursion is normal. As I said before, all areas of the patient's chest rise equally and bilaterally, with no excessive deep breathing. Breathing is shallow. So now I'm going to palpate and see if you have any pain. Any pain with that?
No.
Same thing on the back. Okay. So no palpable crepitus or deformities in the lungs. Patient states that there's no pain upon palpation of the lungs as well. So now we'll just auscultate. If I could have you take a deep breath. Same thing. So lungs sound clear, no audible wheezing, bronchi, or fluid in the lungs as well. So next we're going to take a look at your heart. So I'm just going to palpate the precordium and see if I can feel anything. So I don't feel any thrills with the precordium. Now we're just going to auscultate. So we're listening to the aortic valve. Now the pulmonary valve. Okay, and Erb's point. The tricuspid. And the mitral. Okay. So no audible deformities. Patient's heart rate is rhythmic, and lub-dub can be heard evenly throughout the entire heart sounds. So next thing we're going to do is just have you lie down, and I won't palpate your stomach, that way we don't get your bowels moving, but upon inspection, patient's stomach appears symmetrical. Patient has no visible deformities. Skin appears normal with no rashes. We're just going to auscultate and listen to your bowels. Okay, all set, and you can sit back up. So upon auscultation, patient's bowels sound normal. We would auscultate for 3 to 5 minutes, but upon auscultating for a minute, I would have heard 5 to 30. Patient does not appear to have hyperactive or hypoactive bowels. Next thing we're going to do is look at the skin. So I'm going to check your capillary refill. Okay, so capillary refill is good. Patient's nails return to color within 3 seconds. We're going to check the turgor. So skin turgor is brisk. Patient's skin recoils within a normal time frame. Patient's nails appear to be clean, short, and healthy. No visible clubbing on the nails. And then we're going to check your range of motion. So in your neck, if you can go from side to side, and then to the front and back. Any pain with any of those? Okay. Then I'm going to just feel right here, and if you can open your jaw and close it. Any pain with that?
No.
Okay. And with the shoulder, if you want to just make a couple circles. Same thing with this one. Okay. And then bend your elbow and straighten it out. Same thing with this one. And then if you can flex your wrist and then back, okay? And extend it and then flex it. Perfect. So patient's range of motion is normal. Within normal limits, patient states no pain upon any movement, no palpable crepitus or audible crepitus within the joints as well. We'll do the same thing with the feet. So I'm going to check your pulse. Okay. Good. And then if you can just bring your toes towards me and then back down. Same thing. And then down. And then if you can check your pulse back here. Okay. And then if you want to bring your knee out and then back down. Same thing. And back down. Okay. So patient's pulses in the dorsalis pedis and the posterior tibial are both present bilaterally at a 2+, so bounding, and patient's range of motion within the lower extremities is normal. Patient states no pain upon movement of the lower extremities. And then we'll check the pulses in your upper extremities. Okay. Good. Okay, so patient's pulses in the upper extremities are also present bilaterally at a 2+ as well. No deficits in either arms or legs. And then if I can have you take your fingers, and you're going to bring your fingers to your thumb, and then do it same with the next, and we'll go as fast as possible. Okay, so patient's fine motor skills are present. Patient able to bring fingers to thumb with ease and coordinate that movement. So next we're going to check your strength. So if you want to just push up against my hands, perfect. And then pull back. Okay, same thing over here. And then push back, and then squeeze my hands. Perfect. So patient's upper extremity strength is good, 5 out of 5 bilaterally. And then we're going to push up against my hand, and then down, up, and then down, and then pull back, and pull back. And then can you push up, and push up. So lower extremity strength is also bilaterally equal. Patient has a 5 out of 5 on the lower extremity as well as the upper extremity. And so now we're going to test your balance. So if you could stand up. And I'm going to have you stand on one leg, and you can put your arms out. And then stand on one leg and close your eyes. Okay? Good. So patient's balance is present. Patient able to stand on one leg without excessive swaying or falling over. And if I could just have you walk that way. Yep. And then turn back around. Okay. So patient's gait is normal. Patient's gait is symmetrical. Patient able to walk with ease. Gait is congruent and no listing to either side. And next we're going to do your sensation. So I'm going to poke you with either a sharp object or this cotton ball, which is going to be soft. And if you could tell me where I'm poking and whether it's hard or soft, okay? So if you can close your eyes. And where did I poke?
Hard on the upper right arm.
Okay.
Soft left hand.
Okay.
Hard left lower leg.
Okay.
Soft upper right leg.
Okay.
Soft forehead. Hard left cheek.
Okay. So patient sensation in the extremities is good. Patient able to sense the difference between soft and hard touch. And then we're going to just check your nerves. So can you smile for me? And frown. And raise your eyebrows. And puff out your cheeks. So cranial nerve 7 is intact. Patient able to make all facial movements. Did you have any questions throughout the exam?
Nope.
Okay, well I believe that's the end of our exam. Can you repeat those 3 words back to me that I told you at the beginning?
Apple, cat, house.
Okay, so patient's long-term memory is intact. And do you have any questions?
Mm.
Okay, thank you for your time.
Thank you.